Hello, my name is Brian Wang, and my capstone project is based on my internship at the Harm Reduction Service Branch, Department of Health. My capstone project is about the sexually transmitted infection action toolkit that I created for Hawaiian medical professionals. The action toolkit consists of 12 infographics that tackle a variety of topics including antibacterial resistant gonorrhea, a billing guide, information on expedited partner therapy, providing sexual health services to LGBTQ plus patients, and reasons why to screen for STIs. This action toolkit is a centralized hub of information on STIs for providers and their patients. The purpose of the STI Action Toolkit is to provide a simple and effective way to refresh providers on STI-related information. Neglecting this often translates to the provider redirecting patients to a specialist when they can diagnose and provide solutions on the spot. Providing easy-to-digest material that providers can read and hand out will lessen the burden on specialists and nonprofits and free up room for patients that require it more. The theoretical background around action toolkits is how well it uses knowledge transfer tools. KT tools for short are based on how well the action toolkit probably informs, shares knowledge, builds awareness, change practices, change behaviors, etc. Examples of this are templates, guidelines, and programs. Criteria to assess KT tools should be based on a clear logic, evidence of its effectiveness, a conceptual framework, and built with conceptual barriers in mind. What makes a good toolkit? Number 1, a description of their purpose. Number 2, components that are rigorously developed and backed by high-quality evidence. Number 3, comprehensive delivery methods and implementation processes. Number 4, a rigorous evaluation plan and study design that can help explain change. Orthopedic surgeon Justin Barad explains in simple terms that there's just too much to learn and too little time to learn it. The combination of new information, procedures, technological improvements, and how medical breakthroughs can take years before it's properly implemented can further add to the STI knowledge gap in medical professionals. One of the largest reasons to educate medical professionals is to reduce any barriers, preventing quality treatment and knowledge about STIs to patient. Barriers include language and comprehension, ethical differences, lack of time or training, one's mother or partner, fear of embarrassing the patient, and medical professionals failing to give safe sex advice on the first encounter. Hawaii now ranks 14th in the rates of syphilis among the 50 states. The highest rates of chlamydia was found among Black, Native Hawaiians, Hispanics, and American Indians. Other avenues that have increased STI rates include online dating, poor sexual practices, lack of preventative screening, poverty, unstable housing, drug use, lack of medical insurance or regular medical provider, and COVID-19 related events. The STI Action Toolkit will reduce the stress of the nonprofit organizations, family-owned, and specialized clinics. As fewer patients go to STI specialists, this creates a sense of trust in the local medical providers. Patients will feel confidence in coming in to their providers for any STI problems, and the stigma associated with STIs and the connection it has with sex has been difficult to talk about, especially amongst Abstinence Pro USA. Abstinence programs have been reoccurring as of out of the 50 states, 73 of them require the abstinence program be the primary method of sex education. Abstinence programs start the new generation with a one-dimensional view of sex education. It creates a harsh line between good and bad when learning how to perform safe sex. Relationships building between provider and patients can further connect the community in terms of making the patient feel a sense of trust and quality care. A higher patient satisfaction rate often stems from higher levels of trust between providers and patient. The Action Toolkit collects data from reliable and peer-reviewed articles to ensure quality data. Cultural competency is important because the approach to communicating information to your patients and family members can determine whether they stick to a regimen or lose trust in the health provider and their instructions. Not only do medical professionals need to be culturally competent, but the staff as well. Cultural competency must be incorporated into the staff as well as medical providers to provide the best environment for patients to get the best help they need. Long-term implementation goals are to reduce stigma on STIs, educate the public on safe practices, relieve pressure on private/specialized clinics, and increase the trust in medical professionals to provide quality care. The Action Toolkit contains an infographic providing sexual health services to LGBTQ plus community patients, shows key examples of how to reduce stigma. It goes over creating a welcoming environment, maintaining confidentiality, and guidelines and questions to ask. The stigma around STI further exacerbates social determinants of health. A common misconception when trying to promote STIs is putting negative connotations. STIs being STI free is considered being clean. The intention behind using these words, clean and dirty, puts blame on the individual and further playing into the STI stigma. Using terms like "my test was clean" implies that people with herpes, genital warts, etc. are dirty. This also is known as purity language, and it is how most abstinence until marriage programs go about informing the next generation. Understanding abstinence language is important as a large percentage of the younger population in Hawaii is subject to abstinence programs. Although Elizabeth Smart's quote is just one example, this affects more than just STI patients, but everyone. This stigma makes people second guess their choices as they talk about STIs. Can be daunting, let alone talking about treatment and how an individual can get tested. The STI Action Toolkit, provider training resource, provides sources that both providers and patients may use to better understand STIs and what sources to use to further their knowledge on the subject. STI programs can take an example like Elizabeth Smart into account and rethink abstinence-only programs. The STI Action Toolkit hopes to educate providers and their patients to ensure that misconceptions are debunked and proper quality care is being provided when possible by GPs and other medical professionals.